Welcome back to Professional Perspectives. I'm Marvakella, joined by my co-host Praneeth Vimuri. When people think about healthcare, they often picture physicians, nurses, and patients. But behind every successful healthcare organization is a team of leaders responsible for making sure everything from operations and technology to insurance and patient experience works seamlessly. Today's guest is someone who has built a career at the intersection of business and healthcare.
Joining us today is René Hermes, Chief Operating Officer at Hermes Health. Originally from Lebanon, René graduated with honors from the University of Miami with degrees in international finance and marketing before beginning his career in corporate finance. He later made the transition into healthcare, where he developed expertise in clinic operations, insurance billing, coding, credentialing, and strategic growth. Today, he leads the operational side of Hermes Health, focusing on delivering efficient, patient-centered care while helping the organization continue to grow.
What stood out to us while learning about Renee's journey is that it shows how leadership isn't confined to one industry. Sometimes the strongest careers are built by combining expertise from different fields, in this case, finance, business strategy, and healthcare, to solve real-world problems and improve people's life. Renee, thank you so much for joining us, and for episode 25, welcome to Professional Perspectives.
Thank you. Thank you for having me. It's a pleasure.
Yeah. So, to kick off our conversation, growing up in Lebanon, what first sparked your interest in business and finance?
Uh, I grew up in Lebanon, and I spent the first 18 years of my life there, and the only way I saw out is through education. And since all the political instabilities, um, there was just a few choices. Either you go into education or into trade or into politics, and you're somehow connected, or through family or through connections. So I thought that education would be the best, and I was always drawn to finance and just business in general. It just came naturally to me. Since I was a kid, I always thought about different ways of creating value and understanding how money works and how it moves. And it was always a fascinating subject. So I just went with my gut and did finance and marketing at the University of Miami. My journey kind of evolved and took different shapes as I grew older.
Yeah, and I really liked what you said about how you saw education as your only way out. So to talk a bit more about that, what led you to attend the University of Miami, and how was the experience as like an international student, and how did that experience shape your career?
Well, in Lebanon, I mean, there's a lot of political instability, and you don't want to be involved in um, any of that portion, because there's like so many young lives and talent that somehow they go wasted um, on this. And after years, people sometimes they wake up and sometimes they don't. And in my opinion, any of I've seen friends of mine or people that kind of went in that direction and later regretted it. So for me, I mean, and many other of my friends, actually, we were just focused on education. um, and sadly, a lot of uh, people had to leave Lebanon to go to the Gulf region, or Canada, or America, or Europe. And the only way they would um, they would get there is through some kind of a degree. They have to come in and bring something with them, or else there's like no one's going to give you a visa to live there. Yeah, education was key. In my case, my dad was already living here for a few years. He was in Florida, and he was between like Florida, New York, Boston. But I applied all over the place, and uh, I was going to either go to San Diego State University or BU, Boston University in Massachusetts, or University of Miami. And I just thought that Miami would be like a good experience for me, and it was truly one of the best things, one of the best decisions. It was such a good time. I met a lot of long lasting friends from there, uh, and um, the teachers were great. The lifestyle there was great. Like we definitely had a good time, a relaxing time. The atmosphere there is very, very nice to relax, but to also study. So you have no reason not to study hard and perform good. So our group of international students there was a pretty nice group because we all wanted to have a good time and experience college at its fullest, but at the same time, we needed to perform and bring back really good grades and just kill it that way. And that's what we did, and that's what I remember bonded us. And and like recently, I saw a bunch of my friends from University of Miami at a wedding this past summer, and it was just great. Everyone just reminisced on how amazing that experience was.
That sounds amazing. I feel like the college experience was just so like so great for you at University of Miami. And kind of tying along with that, what are some lessons that you learned from college that kind of influence you on and how you lead today?
Um, you know, college gives you a platform to work on, and it introduces you to some life like experiences. Whenever you're given certain projects, uh, you tend to see if you're someone that works better in groups, and if you do work in groups, are you kind of the one that takes the lead and present it? Are you the one that puts together a kind of like uh, the band orchestra? Like are you the one that puts together everything, or are you the one that's a little bit more on the quiet side, that's doing a lot of the work, or are you more of the second in command? Which is second in command sometimes does much more work than first in command. It's so it kind of makes you see in which direction your professional career is going to go in, um, and and sometimes you just you'll also know if you're more efficient by just working alone and then coming back to the group and kind of telling them what you worked on. So it's really those experiences, I think they carry on to your professional work later on.
Yeah, I totally agree. I feel like any education seen, whether high school or college, I think is like pivotal for kind of shaping you as a person and giving you lessons that help influence your day to day and work later. But yeah, now talking more about your career, transitioning from finance into healthcare isn't too much of a common path. So, what inspired that career change, and what was like the motive behind it?
Yeah, great question. So actually, when I graduated 2008, it was in the midst of the financial crisis. So um, it was a time where a lot of the people that graduated thought about um, having more of a secure path towards gainful living. So my first job was a financial analyst, and that was overseas. So I went to Qatar at the United Development Company, a publicly traded company in Qatar. They're the ones that did the Pearl Island, the man-made island there, and it was such a great experience. I was a financial analyst there, and I uh, learned there. It was in Qatar that I learned that you need finance in every single aspect of your life, because that company, United Development Company, created an entire product from scratch. So for example, they needed to dredge the island, like to create the island, then they needed to build all of the towers. So we needed to figure out how much like, how do you sell an apartment if you don't have comps? So basically, you have to figure out how much it costs. So you have to put all of those costs together, and then you have to put in your profit, and then come up with the cost of a certain unit when you're selling a tower full of units. And then, they needed to bring shops and fashion outlets and boats, like marinas where people can dock their boats. And they needed to bring education and clinics, and they were creating an entire village basically from scratch. So I found out that, corporate finance and finance in general is not really just limited into uh, banking and stock market and wealth management, and so it really uh, kind of opened my eyes on the different ways you can use finance. And during the recession, I thought it would be a good idea to be in healthcare, because healthcare is kind of a recession-proof industry. Um, and my grandfather was a doctor. My brother was studying to become a doctor. I had just met I recently met Nisreen, who's now my wife. She was studying to be a doctor. So that field kind of always intrigued me, but I knew I didn't like the medicine, like the biology part of it, um, and drawn more into finance. So I thought, there should be a way to combine those two. And there is definitely. I mean, the healthcare system has a giant financial machine behind it that keeps it running. So uh, that's how I got into that.
Yeah, and one thing is you joined during like this time of recession and there's always so much uncertainty during these times. Was there any moments where you questioned whether you made the right decision early on?
Yeah, all the time, because basically when I left Qatar after 4 years of being there, and I had a nice and steady job, I brought all the money I saved, and I came here and I thought, okay, I'm going to open my own business. So I opened Hermes Anasaf. It's a medical billing company. And my first job was to go out there and get clients. And the second job is to service those clients. But to go out there and get clients, it was hard, especially when you're first starting out. Um, and I would question every day whether, is this ever going to happen? Am I ever going to find a client? Um, am I, you get to have that like imposter syndrome where you feel like, how come, like, why would anyone give me their account when I'm just starting out? Am I going to do good by them? And I did. Actually, the first client I got, um, his name is Dr. Miller, who now passed away. I worked with him for a decade before he passed away, and we had such a great relationship. I did so well on his account. I almost doubled his income, and I collected more than six figures of money that the previous billing company did not collect. So he was really, really uh, kind of proud of the work. He would always like tell everyone how much like he enjoyed working with me. And not just because like we had a good relationship, but also you have to come back with results. I'm a very result oriented person, and if you come back with good results, well, you can that's what makes the project successful. But yeah, there was a lot of doubt. It took almost like 3 months to find my first client. And when I did, I really took it seriously. I researched a lot. I took a lot of time to make sure I was doing everything correctly. And I took a lot of advice from different mentors in the field, like specific to the medical billing and coding. And I took certifications and classes, and went on Medicare websites, and went through all the like self-help tools. So I took it seriously. I wanted to do good by my client, and from there it's just getting better and better. And once you do good work, you're going to get recommended to other people, and at some point you're going to have to turn away business. So that's kind of how, if you do it properly, you will get to the point where you will have to turn away business, or you just have to grow and get people on board with you that are an extension of yourself, basically.
Yeah, that's amazing to hear. There were a few things that came up to me. First was in one of your previous answers about how you talked about moving to an industry that is recession proof, and I felt like that was a very logical and actually interesting decision, which I wouldn't think many people would think about originally. And it's actually really cool to see how you transformed into originally finding guests to then them coming to you, and then you maybe having to turn them down because of how many clients you're already taking on. So it's really
Mhm.
cool to see that transformation, and I think it can speak to our audience about how persistence and resilience kind of gets you the success that you were talking about. Um, and now to talk more about your career. So what do you do right now in a day-to-day basis, and what's your title, and what does a typical day like that look like for you?
Yeah, currently I still manage my company that I had opened in 2010. So it's been 16 years where we do medical billing, coding, credentialing. We handle hospital contracts, insurance contracts, and the day-to-day servicing of my clients' accounts. And I have a very talented team behind all that work that help me to service those accounts and make sure that we're collecting on all the claims and doing good by our physicians, because physicians that own their own practice, uh, they have to spend on malpractice insurance, on rent, on employees, on they have to spend on so much on a million things, supplies, clinic rent, all kinds of stuff. And the only way of their only income, like their biggest way of income, is through the medical billing, insurance billing. So you really need to make sure that that you don't mess that up. Uh, but if the title would be just owner and CEO of Hermes and stuff. But also throughout the years, um, when Nisreen graduated from medical school, I told her that we need to open up our own clinic, and she was completely on board with that. Because I said, well, I'm already doing this for other physicians, and I figured that being in private practice is could be profitable if the billing and the coding and the credentialing and all the contracts are put in properly and they're tuned in just right. It could be a very profitable proposition and an amazing lifestyle. Um, I hate to see doctors being burnt out and being so miserable at their jobs, at their like hospitals or clinics or employment. And I just thought that like there's definitely a way for us to do this. And Nisreen was completely on board because that's what she had always dreamt of and imagined when she first went into medicine. So. We started the clinic, and I was the chief of operations at Hermes Health. And slowly that became my main focus because the clinic uh, 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 took a lot of my time, because not only are we managing just the billing and coding and credentialing, but then there's all the different aspects of managing a clinic. So it kind of helped my current clients at Hermes and stuff, because now I had exposure to every single aspect of managing a clinic. But I also needed that's when I expanded my team at Hermes and stuff. I also sold some of the medical billing accounts to other medical billing firms that are colleagues of mine, that I knew they would be in good hands. Like the smaller accounts, and I just left the ones that I could handle with the team that I have. It's a close knit team, and started the main focus on the clinic, and that's been for 10 years now. So I have two roles: the chief of operations at Hermes Health, and then owner, uh, you know, operations also at Hermes and Asaf.
Yeah, it's actually really inspiring to hear how Hermes Health actually got to grow through the practice of actually owning a clinic as well. And one thing that I think is super important when having a company and growing it is like having one strong goal and like one clear motive. And when we were doing research on Hermes Health, it emphasizes how they center around patient care. What does that philosophy mean in actual practice?
Yeah, so we wanted the experience for the patients to be different from other clinics. Usually, other clinics, most of the time, the front end of the visit is always not very pleasant. So, from the moment you call, make an appointment, figure out the schedule between you and you know your schedule, the provider's schedule. Um, then getting a link, having to fill out all that paperwork, or even worse, you show up there and then there's like pages of paperwork that you have to fill out. And then you wait and you wait and you wait forever, and you wait in the waiting room, and then you go in, and then you wait some more in the room itself, and then one person comes in, takes some vitals, another person comes in, does the intake. So there's all leading to your physician visit, and then that happens so quickly. It's like a 5-minute visit, like maximum 10 minutes. So we wanted to change that completely, and um, we thought that visits should be around 45 minutes long. We thought that every provider, instead of seeing 20 patients, 25 patients per day, we're going to shorten it to 10 patients per day. We're going to want the provider to do everything from A to Z. So basically, um, you go into the room, you rarely have to wait at all because we've got a lower, like turnaround. So if you come in on time, you're going to be seen within 5 minutes. And the provider that's doing the intake also draws your blood, also talks about your symptoms, does the diagnosis, does if there's any procedures that needs to be done that same day, we do have the time to do them. We don't have to have you go and schedule and come back and pay another copay. Um, uh, and that provider basically, this entire time they're building that rapport, like between you and the provider and the patient. There aren't people going in of the room, out of the room, and out, like different people. And that's how you create a relationship. This is why a lot of families, they come to us, because first the mom comes in, then she brings her husband, then her kids, then her mom, her neighbor, like, and people just love that, like that boutique feel, that neighborhood clinic where we know you by your first name. It's a familiar place. It's not a place where you walk in and it's so sterile and your blood pressure is up the roof and you're like stressed out. And so we just wanted to focus on the experience overall. Uh, uh, Other than, and on top of that, our providers are extremely serious about their knowledge. So always up to date on the all of the like medical journal, with all the medical journals and all the studies and all that. So everyone that works at Hermes Health has like they're like top notch when it comes to medical knowledge. So when you combine those two, I mean, it just makes it so much easier and stress free for the patients, and that was our main goal.
Yeah, and also I really appreciated the fact about how you kind of had the patients in mind first when you said you turned down the number of patients, I think from 25 to 10 to kind of decrease the turnaround rate. And even though I might imagine it might hurt you guys more fiscally, it gives a better patient experience, which I think shows a lot about the kind of company you guys are and the emphasis you have on patient care.
Yeah, and
Uh,
I just
yeah.
want to also one thing. Not only is it good for patients, it's great for our providers because providers have a good quality of life, like a work-life balance. Imagine if you see 20 patients per day, then the following day you open up your computer and you have 20 lab results and imaging results and stuff like that, and you have to make 20 phone calls. Now they make 10. It's half. So they're not stressed out. And then, if you're a provider and you're inside the exam room, and you know that there's 5 6 people waiting for you in the waiting room, you're just stressed out. You're wanting to get people in and out. Versus if you know that you're good on time, you're gonna be like, you as a provider, you're gonna perform better, and you're just going to have a better work-life balance overall. So we believe that if our staff and if our providers um, are happy, then the patients are going to be happy, and there's no reason for anything to be missed, and there's no reason for a lot of follow-up phone calls, follow-up messages, like, oh, I forgot to ask you this, I forgot that. Like, there's ample amount of time. So it just works out so great, this entire 45-minute appointment with for everyone, both the providers and patients.
Yeah, I could totally imagine. And I think based on what I understood too, I feel like it's a win-win situation kind of for everyone, both the patients and the providers. And that's really cool because I do agree about how if you know you have something pending, like maybe 5 or 6 people outside in the waiting room, of course, subconsciously you're going to work differently than you would if there was no one there. So totally agree with that. Um, and now to talk more about your leadership qualities, what leadership qualities or do you think are most important for managing teams in general, but also like specifically in healthcare?
Yeah. So uh, if you are both a leader and manager, you need to um, you need to if you're taking on both roles, you have to be very careful because there is a line that differentiates leaders from managers. As a manager, you're kind of a more of a um, day-to-day operations. You're kind of uh, hovering over the staff, making sure that, like, they everything is done properly. Making sure, like, the equipment that we have, the inventory, everything is topped off. Like, you're into the nitty gritty details of the day to day operations. As a leader, you're more about the overall vision, where the company is going to be headed, uh, how much we're going to grow, like the amount of staff, or do we need to add locations? Are we adding services? Are we, more of a macro stuff. So if you're taking on both roles as leader and manager, then and that's kind of where I'm at. Uh, what I tend to do is that I take a lot of my managerial tasks and I assign them to certain key employees in the organization, and I try for my job to be more of making sure that all of those tasks are being done at the highest level, and then they're being reported back to me. And then I come in only when there are issues, or when there are any uh, you know anything that requires my personal attention. um, and at the same time, because I feel like, it's the leadership roles that make a little bit more of a difference overall, and that are more important. You need to have a strong leader with a good sense of direction on how the business is moving forward, and those are the decisions that um, you have to come up with at the right uh, at the right time. Also, like, for example, right now at Hermes Health, we have capacity on how many rooms could be filled and where we can see patients because of the square footage. But then we wanted to expand our services to something beyond the square footage, so we started thinking about home visits. And after thinking about it, we thought that, well, we can package it up in a really cool service, like a boutique medicine program that we'll talk about in more detail. Um, so those are kind of uh, the decisions that I think about all the time, and and sometimes it's challenging to divide your brain into like leadership mode versus managerial and tasks, like stuff that needs to be done in a timely manner. So it's not easy, but you have to train for it and get your brain to kind of agree with the uh, with the amount of hours you have per day. I mean, it gets challenging, but it's doable.
Yeah, it's really inspiring to hear how you've set up your company, and it sounds like you're really knowledgeable on like different aspects of it. I really like the boutique value, boutique like aspect of the clinic, and all these different things. However, like no matter how knowledgeable, no matter how well you set up a company, sometimes they do face setbacks. Can you share an example of a setback that happened and how you bounced back from it?
Mm, yeah, you know, one of the one of the most challenging things in any service company is the staff, because basically, if you're doing such an amazing job, and let's say you're a great doctor, you've got a winning personality, top medical knowledge, great sense of humor, all of the positive things that one can imagine, and then there's just too many patients that want to see you. Well, how are you going to duplicate yourself, right? So then finding someone to hire that will join the team feels like a little bit of a setback, because you're spending a lot of time trying to look at all those resumes and interviewing people and bringing in people. But then when you do, it's the most satisfying. It just clicks. Everything makes so much sense, and like, oh my god, where were you all this time? uh, and that's how we feel with all of the people at our clinic. They're like family to us. uh, the main setback comes when someone needs to move on, like let's say uh, uh, a physician assistant um, recently left so that she can go into a different field. So we're a family medicine practice. She wanted to be into psychiatry and in a psychiatry clinic, and she was so great. All the patients loved her. She was sharp. She was, she was exactly, who someone that would fit in perfectly at our clinic, and she stayed for years, multiple years. Um, and it's always hard when you have someone that's a big part of your team that decides to move on to a different position, whether and she also moved houses, so like she wanted to be closer uh, to her um, to her house. But the main reason was she wanted to be more into psychiatry, which we see a lot in family medicine. But yeah, I mean, when someone leaves or they put in their notice, it definitely feels like a setback, because I mean, the clinic, the service industry, we're not selling a product. We're selling the service, and a big part of that service is the people providing that service on a daily basis. So um, finding someone new in a timely manner, right? Because once someone gives their notice, it's like 90 days, and so the clock starts ticking. You need to find someone. So that kind of felt a little bit of a challenge for us, but with a little bit of luck and good karma, we tend to believe that if you're doing something good and you're just good people overall, you're going to attract good people, and that's what that's what ended up happening, and we were so lucky to add on two new team members that are just great and just such a great addition to our clinic.
Awesome. Yeah, that sounds really cool, especially in the fact about how you're growing at a really cool pace, but also kind of expanding your care. Like you talked about the home visit part, that is definitely really interesting to me. And I feel like it's a great way for you to expand it. And it's also really interesting because you said we're not selling a product, we're selling a service. And I feel that kind of emphasizes what you guys do really well and kind of showcases your mission and your goals. But as we do start to wrap up, for our final question, I just want to talk about going like into the future, right? So when people think about your career like years from now, what impact do you have hope to make? Like what do you hope that you can do the next 5 to 10 years? What are your goals? Where do you envision yourself? Like looking into the future, what do you think is gonna happen?
Yeah, I would like to be uh, the guy to be remembered as someone that brought in value into uh, the medical service and how we interact with medicine. Um, because you can do all kinds of stuff, uh, but when you do need a doctor, uh, whether it's emotionally or physically, everything comes to a halt, and and you need to kind of face the music. So whenever someone comes in that situation, they're very vulnerable, and they need an advocate by their side, someone by their side that can really understand what they're going through and be um, nice about it, empathetic, and just like feel with the person. So it's very important to make it a good experience. So this is why we thought that introducing home visits with our boutique medicine program, it's a subscription program that goes beyond just making the a phone call and coming into our clinic. With that for the next 5 to 10 years, that's the program that I feel really strongly about and that we would like to develop, where you get a direct access to your provider. You get the phone number, like the cell phone number. Instead of having 2,000 patients per provider, because that's the average panel for a primary care doctor is around 2,000 patients, which is a crazy amount of patients. Like imagine you have like all of them call all at once, or like, and it feels like it all the time because 2,000 is a big number. So we want to reduce that to only 200. So we started this program just now in the past few months, and we're trying to get members in the door, and we just need 200 members, and we are hiring one family medicine provider, board certified, to take over this program. And you'll get the cell phone of that physician. It's kind of like having a friend physician, like, hey, that's how I'm feeling, like, what do I need, like, hey, I have a UTI here, I have a sore throat, and then it just sends you the prescription. And you do like monthly visits, you do like a yearly physical, the provider goes to your house, goes to your uh, office, draws your blood. There are conversations about your health. If you ever face a health event, that provider is talking to all the specialists, making sure that you understand all this stuff, because sometimes so much is happening around you, and specialist visits are just like 2 3 minutes. Then it's nice to have a family medicine physician kind of explaining the whole thing. And um, so it's the boutique medicine program is where my focus is for the next few years for sure. And that I think is all about making the experience better for the patients. And for now, our insurance, the insurance money is not something uh, that pays for the program, because it's a $500 per month. That's additional on uh, that's addition to insurance. But what we're offering is that it's unlimited consultations. So you pay $500 a month, and you can call anytime, SMS call, FaceTime. And if the doctor feels like, I need to come to your house, they'll come to your house within 20 miles of Oak Park. So we don't go through insurance for that part. So it makes it just less cumbersome overall for the entire patient experience. They don't have to worry about like copays, deductibles, paying a bill. It's all taken care of. You pay that 500 a month, and then you're good. We do a personalized nutrition plan. We do like make sure you got all your vaccines. We answer any questions in depth. If you send a message, you'll get a response fairly quickly. So more of a personalized medicine. Um, that's the goal.
Mr. Hermes, thank you so much for joining us today. This conversation has shown us that delivering exceptional healthcare requires far more than just clinical expertise. It also requires strong leadership, thoughtful strategy, and a commitment to putting patients at the center of every decision.
What really stood out is how you've combined your background in finance with your passion for healthcare to be able to create meaningful impact. Your journey reminds us that careers don't always follow a straight path. Sometimes the skills we develop in one field become the greatest strengths we bring to another.
And thank you so much for sharing your experiences and insights with us. And to everyone listening, thank you so much for joining us on episode number 25 of Professional Perspectives. We hope today's conversation encourages you to stay open to new opportunities, embrace lifelong learning, and remember that leadership is ultimately about serving others. Until next time, thank you so much for listening to Professional Perspectives, and keep on exploring your professional perspectives.